Hello, and welcome to Goniometry with NUPT. In this video, we will explore supination, specifically the importance of and technique of goniometric measurements of supination. By the end of this video, you should be able to explain the motion of supination, identify the joints involved in supination, name indications and contraindications of measuring supination, identify normal range of motion values for supination, and explain how to correctly take measurements for active and passive range of motion for supination. This includes proper therapist and patient positioning, proper stabilization, and proper goniometer alignment. Supination is a movement of the forearm. It involves going from a neutral hand to palm up. During supination, the radius rotates around the fixed ulna at the superior radial ulnar joint within the annular ligament. This is a pivot joint. The ulna and the radius roll and glide together at the distal radial ulnar joint. The main muscles of supination are the biceps brachii and the supinator muscle.
Some indications for measuring supination include tracking functional range of motion improvement in therapy. A contraindication would be if a doctor recommended that no motion occur at the joint post-surgery or dislocation. The functional range of motion is important to consider when doing therapy, which is 50 degrees of supination, because usually we don't work at our extremes in end range of motion, but regular range of motion is 85 degrees.
Studies have shown that inter-rater and intra-rater reliability of goniometric measurements of supination is high.
Now we're going to go over the testing steps for goniometry of supination. The first step is to expose the area to be tested. The patient should be seated, shoulder adducted against their body and elbow flexed to 90 degrees. The forearm should be placed in neutral and supported by the table. The physical therapist will stabilize at the distal humerus during measurement. The axis of the goniometer will be medial and proximal to the ulnar styloid process. The stationary arm of the goniometer will be parallel to the midline of the humerus. The moving arm will move flat across the forearm, remaining proximal to the ulnar styloid process.
Hello Jess, my name is Morgan McCardle and I'll be your physical therapist today.
Hi, nice to meet you.
It's really nice to meet you too. How is your wrist feeling?
It's a little sore.
Yeah, after you broke your radius. I know it was in a cast for a while, but you've been cleared by your doctor to start moving it around, and so I'm going to measure how much rotation you have in your forearm.
Okay.
Today, alright? So first thing I want you to do is, will you roll up your sleeve for me in your left arm? Good, I need to be able to see. And then now we're going to get you in the right position, so I just need you to put your forearm on the table, and you need to make sure that you're sitting up straight, and this is right by your body. Good. Okay, and the motion I want you to do with your thumb up like this is just put your palm up as you rotate it onto the table. Okay, bring it back. Any pain with that? Good, okay. And now I'm going to do the motion for you. I'm just going to stabilize you here. I'm going to hold your hand here. I'm just going to do that motion for you. Any pain with this?
No?
Okay, awesome. And now I'm going to measure that. So if you can just keep your thumb up like that. Okay, if you want to do that motion. Okay, I got about 65 degrees. Okay, now I'm going to do that motion for you. So I'm just going to put the goni here. Rotate your arm down. Looks like 65 degrees again.
This concludes our session for goniometry of supination. Thank you for joining us.